Hi folks, Dr. Tortland here. One of the most common questions that I get asked regarding stem cell treatments for joint arthritis is whether this is going to take the place of a joint replacement. People often ask me, if I have a stem cell treatment, will that give me a new knee or a new hip or a new shoulder? Will I eventually need to have my joint replaced? Well, let's talk about those questions for a moment. Let's start by talking about joint replacement surgery. Now, I know most people coming to me are not interested in joint replacement, but at least let's talk about that since that is the reference standard. Statistically, 80% of the time, a knee replacement goes very well. And when it goes well, that joint is going to last you between 15 and 20 years. That means it's a one and done. You don't have to think about it for the next 15 or 20 years. Of course, if you are going to be having that joint replacement at a young age, that may mean having a replacement of a replacement. If you have a joint replacement at 40 years old, you're looking at another joint replacement at about 60 years old. But my point is this: a joint generally lasts 15 to 20 years when it goes well. It's a one and done treatment. Now, what the surgeons don't tell you most of the time is that at about 20% of the time, that joint replacement doesn't have the desired outcome. In other words, you may not regain your full range of motion. And in 1 to 2% of the cases, you could have very serious outcomes such as serious infection and in some cases even death. So joint replacement surgery is not a slam dunk, but in 80% of the cases, it's going to do really well for 15 to 20 years. Now, when we consider stem cell treatment, that's not the case. The only way to get rid of an arthritic joint is you got to get rid of the joint, which means a joint replacement. But I don't want to have a joint replacement, people say. I understand that, but that's the only way that you actually get rid of the arthritis. What does a stem cell treatment do? It really changes the biological environment inside that joint. It can provide tremendous relief of your symptoms. You can get your range of motion back, you can get your flexibility back, you can get your quality of life back. But at the bottom and at the end of the day, you still have an arthritic joint. The other thing to consider with these stem cell treatments is while you can get tremendous relief, if you don't take care of that joint over time, eventually the benefits of the stem cell treatment will wear off. Think of a stem cell treatment like taking care of your lawn or your garden. You spend a tremendous amount of time, energy, and money putting in a beautiful lawn or a beautiful garden. You have this great lush lawn or this beautiful flowering garden, lots of fruits and vegetables, but if you don't take care of it, what happens? In the case of the lawn, the weeds and the crabgrass grow up. In the case of the garden, the weeds choke out all the fruits and vegetables, and all your time and effort and money is wasted. So what do you do with your lawn or garden? You fertilize it periodically. The same thing is true with stem cell treatments. If you have a stem cell treatment for arthritis, you can get tremendous relief, 70 to 80% chance that you're going to have a good outcome with a stem cell treatment. But periodically, typically every 8 to 12 months, roughly once a year, you need to have a fertilizer treatment, which is a single, simple booster treatment of some platelets into the joint, which is your fertilizer treatment, and that helps the stem cell treatment maintain its benefit for the long haul. I've been doing this since 2008, and I've never had somebody had to go back and repeat a stem cell treatment as long as they kept getting their once a year or periodic PRP treatments. So that's how you have to think about these two things. Now, there's one important point regarding the stem cell treatment. I mentioned that in surgery, approximately 20% of the time you don't have the desired outcome, and 1 to 2% of the time you have a bad outcome. In my practice, we've never had anybody been made permanently worse by a stem cell treatment. So it's one of those treatments where you have a tremendous amount to gain and really almost nothing to lose by trying it. If you have any other questions about stem cell treatments versus joint replacement, don't hesitate to give us a holler. We'd be glad to talk to you about it.